Zambia, and welcome to another episode of the Smart Voices Debate, sponsored by Zambia Revenue Authority. My name is Chanzi Sikaze, and I'll be your host for this season. Today's debate we have proposing Nawoya Secondary School and opposing Mukamambo II Girls Secondary School to the motion that states, and I quote, "This House believes that creating a special health tax will benefit funding to the government-run clinics and hospitals in Zambia." And I repeat, this House believes that creating a special health tax will benefit funding to the government-run clinics and hospitals in Zambia. I will now read the rules of this debate. Number 1, no religious references, quotations, or concepts will be allowed. Physical evidence is allowed, which includes a demonstration of evidence and shall be handed over to the adjudicator, handwritten, printed, or published materials. The following items are prohibited in the preparation room: mobile phones, particularly smartphones, cameras, tablets, PCs, MP3 players, and anything that can store data electronically and or connect to the internet. All phones must be on silent. The sequence of debate shall be as follows. The first speakers on each team present. Their arguments for 4 minutes, no interjections will be allowed. The second and third speakers will speak for 3 minutes. Interjections will be allowed. The speaker summarizing will be allowed 4 minutes, no interjections. Interjections are allowed and shall be done as follows. Interjections will be allowed after the first 1 minute of a speaker taking the floor. Each interjection will be done within a minute. A speaker can only be interjected twice. The moderator will enforce the rules allowing or rejecting interjections or calls for support. The timekeeper will pause the speaker's time when there's an interjection. And lastly, a team can propose to support a speaker after an interjection. I will now call upon the first speaker from the proposing side to start us off.
Illustrious moderators, eminent judges, respected opponents, members of this intellectual house, all dignitaries and protocol established. I stand to you as the firstborn speaker from the proposing side, proposing to the motion that states, as I quote, "Creating a special health tax will benefit funding to government-run hospitals and clinics in Zambia." But before I continue, allow me to point out the key words that have been stated in the motion, with reference made from the Oxford Dictionary of Current English. So the dictionary defines tax as money that must be paid to the state, charged as a proportion of personal income and business profit or services. Health is defined as the state of being free from illness or injuries. Funding is the sum of money saved or made available for a purpose, and benefit is an advantage or profit. May the illustrious moderator take this to the judges for clarification. Members of this intellectual house, syntax as a health funding strategy. If we were to impose the syntax to help benefit these government-run hospitals and clinics in Zambia, we would be imposing them on harmful products like tobacco, alcohol, and sugar-sweetened beverages by increasing their costs, therefore decreasing consumption. This dual-purpose mechanism not only generates revenue, but also addresses them as the root causes of many non-communicable diseases, such as cardiovascular diseases, lung cancer, as well as diabetes, potentially reducing long-term healthcare costs associating with treating these conditions. So many advocates have pointed to many successful examples of countries that are imposing this syntax, such as the United States, South Africa, Rwanda, as well as the Philippines, serving as a tool to improve public healthcare and boost funds, as you can see from the table. May my good moderator take this to the judges for clarification. Members of the auditorium, we cannot deny that our current healthcare system is severely underfunded to the point that even the thermometers are on strike. Walk into any government clinic today and you see the story behind it. Overworked nurses, worn out beds, empty dispensaries. These aren't isolated incidents. They are symptoms of a system stretched to its limits. At the heart of this crisis only lies one undeniable truth. These resources do not match to the demand. And that is why the additional revenue from this tax can be used to achieve universal health coverage by funding a more robust and comprehensive health benefit package. It will also allow these hospitals to improve infrastructure, acquire modern medical equipment, and provide the essential medication and diagnostic tests. directly translating to a higher quality care for patients. When you look at a private system, the rich live, but the poor have to wait and in the end, they will die. But if the public system is properly funded, the healthcare stops more about status and starts being more about need. And so funding public hospitals through a tax-based system is often considered a more progressive way to finance healthcare rather than relying on insurance-based models, particularly in these low and low-middle income countries, as it will help meet the health needs of this entire population, including the poor and disadvantaged, because they are all catered for due to this tax, and is also aligned with the goal of the universal health coverage, which the World Health Organization also is in support of. As a speaker who speaks from within and not from without, allow me to quote from an article that was written by Harriman Mono as well as Abdo S. Yazbek on the case against labor tax finance social health insurance for low and low middle income countries, dated May 2020. May my illustrious moderator take this on to the judges for clarification. So all in all, members of the auditorium, this motion is not a plea for additional taxation. It's a principled call for structured, sustainable investment in Zambia's public health infrastructure. A special health tax, 30 seconds to wind up.
30 seconds allowed.
A special health tax judicially implemented stands as a fiscally responsible and morally necessary intervention, one that redirects national priorities towards safeguarding life and dignity. Rejecting this motion is more like going for underperformance and silent suffering. And so will we allow it as a country? Certainly not. And that is why this House truly supports that creating a special health tax will benefit funding to government-run clinics and hospitals in Zambia. And so we as the preposition endorse it as an imperative for national resilience and equity. Members of this auditorium, with these few but affirmative points, I submit to my moderator.
Thank you so much, Madam Speaker, for those breakdowns. I'll now call upon the first speaker from the opposing side.
Funds were lacking, plans are cracking, voices backing. More money won't fix a system riddled with inefficiency. Before I go any further, allow me to state that all protocol be highly and deeply observed. Bouncing back to the motion which states as High Court, this House believes that creating a special health tax will benefit funding to the government-run clinics and hospitals in Zambia. End of quotation. As the first speaker, or rather the icebreaker, it is my duty to define the following key terms. Health, the state of being free from illness or injury. Tax, money that must be paid to the state. Funding, a sum of money saved or made available for a specific purpose. Special tax, tax imposed for a specific purpose rather than for general government spending. Government, the group of people who govern the state, which reference from the Oxford English Dictionary, may the Good Samaritan please do as wise. Heading on to my staple analysis, which goes as follows. As the first speaker, I'll talk about existing insufficiencies remain, lack of legal protection for health tax funds, and weak monitoring at facility level. Then my second speaker will talk about lack of guaranteed allocation, weak transparency and accountability systems, administrative leakages and corruption, and procurement irregularities. Then my third speaker will talk about shifting government priorities and equal distribution, poor revenue collection performance, and bureaucratic bottlenecks. Then my summarizer will summarize, analyze, otherwise you won't understand. Honorable adjudicator, as ZRA reminds us,
my tax, your tax, our destiny.
Yet, if a special tax still doesn't guarantee better funding, then what becomes of our destiny? That leads me to my first point, which states existing insufficiencies remain. If internal insufficiencies remain, additional funding won't solve anything. Talking of internal insufficiencies, we're looking at corruption and systematic theft by people who've been entrusted with these funds. Going back to the year 2021, a report was given by the World Health Organization saying that 30% of the health expenditure is wasted due to poor resource management and inefficiency when handling the funds. May the Good Samaritan please do as wise by passing on the evidence to clarify my point. Going on to my second point, which states lack of legal protection for health tax funds. Unless tax is legally reinforced by the government, more funding won't solve anything. Zambia's Constituency Development Fund, known as CDF, which is still being diverted in different constituencies, is still facing misuse. This shows that even government protection still does not guarantee proper funding. Even if a Zambia were to cite dedicated accounts, these funds can still be redirected when the government's priorities change. Going on to my last but not the least point, weak monitoring at facility level. Even if money reaches districts, monitoring at facility level is very weak. Thereby, a report was given in the year 2022 by Transparency International Zambia, TIZ, that many rural health posts do not keep proper expenditure and accountability on how funds were being used, thereby making it very difficult for Transparency International Zambia to know how funds were catered, but making it very easy for these people to swindle and embezzle these funds. With these few convincing points, I salute to the judges and I bow to the audience and I rest my case.
Thank you so much, Madam Speaker, for not only breaking the ice but shattering it. I will now call upon the second speaker from the proposing side.
Honorable Chairperson, respected judges, worthy opponents, and members of the House. As the second speaker of the proposition, I stand here today to remind that, as the great economist Adam Smith once said, taxes are what make a society to be civilized. Members of the House, I strongly propose to the motion that states, as I quote, creating a special health tax to benefit funding government-run clinics and hospitals in Zambia. End of quotation. Allow me to defend my argument with the following points. A special health tax provides reliable, dedicated funding. Right now, many government clinics rely on inconsistent budgets and donor support. That's like trying to run a hospital on pocket change. It's just not sustainable. Members of the House, with proper funding, we can build a healthcare system that works every day for every Zambian. And according to the Center for Trades Policy and Development, a health tax would be a way of securing sustainable financing for Zambia's health sector. To prove that I'm a speaker who speaks from within and not from without, may a good Samaritan pass this to the judges for further clarification. A special health tax also promotes equity and transparency in resource use. By dedicating revenue specifically to health, we ensure that funds are transparently tracked from collection straight to the clinic,
Point of interjection.
demanding accountability.
Point of interjection allowed.
Affiliates of this session, the current speaker talked about equity. But have you realized that Zambia's healthcare does not have equity? Because if we look at the national health budget gives urban areas about 60% of the national health budget, whilst rural areas where most citizens live get less than 40%. So please, clarify your point.
Point of defense.
Point of defense allocated to the panel.
Yes. As the motion states, creating a special health tax. Creating. So if we create a special health tax, it will cater for every citizen in the country. This is about creating, it's not about something that's already there.
Point of defense.
Point of defense denied. May the current speaker continue speaking.
Point of defense.
A special
Point of
health
defense
tax.
denied. May the current speaker continue speaking.
A special health tax is critical for reaching every Zambian, no matter where they live, and it's not just about the money. Evidence shows that taxes also leads to healthier choices, which makes everyone happier in the long run. We don't need to guess if this will work. Many countries, including our neighbors, South Africa and Rwanda, have proven that these measures both raise predictable revenue and actively save lives by promoting healthier lifestyles. To prove that I'm a speaker who speaks from within and not from without, may good Samaritan pass this to the judges for further clarification. A special health tax also ensures investments in health infrastructure. Right now, our clinics often suffer from inadequate equipment, outdated facilities, and in some cases, a lack of basic utilities. With a special health tax, we can directly fund the construction of modern facilities, purchase life-saving equipment. Members of the House, they say health is wealth, but in Zambia, our clinics are so broke, they must start prescribing Panadol and sprayers. Members of the House, this isn't just an abstract concept. The World Health Organization has consistently emphasized that dedicated health financing is essential for strengthening healthcare infrastructure and improving health outcomes, especially in areas lacking most facilities. Members of the House, let's face it, no one loves taxes. But do you know what people love even less?
Point of defense.
Sitting-
Point of interjection denied. The speaker is in his last 30 seconds.
Members of the House, no one loves taxes. But do you know what people love even less? Sitting in a clinic for hours since yesterday, waiting for the hospital, waiting for the doctor. If a special health tax is introduced, this will... 30 seconds to round up.
30 seconds allowed.
If a special health tax is introduced, it will help medical facilities in Zambia. As I conclude, I propose that this special health tax should be the cornerstone for a healthier Zambia. It's not just about the money, it's about building a stronger, healthier system for Zambia. Let's invest in the health of our people, because a wealthy nation starts with healthier citizens. I therefore stand proud and free to affirm the motion.
Thank you so much, Mr. Speaker, for educating us on this matter. I will now call upon the second speaker from the opposing side.
Raising, grazing, facing, blazing, standing, goes on chasing. But before I go any further, allow me to write on protocol set by my Prime Minister according to order of seniority. In short, I simply say, may all protocol be highly and deeply observed.
Observe.
I'll strongly be opposing to the motion that states, as I quote, this House believes that creating a special health tax will benefit funding to the government-run clinics and hospitals in Zambia. End of quotation. Without wasting much of your time, allow me to move on to my first point, which states corruption and procurement irregularities. Members of this House, we've already seen situations where the government has been given huge sums of money for them to reduce the standards in their health institutions. But we'll find these situations whereby people go to the hospitals, but they'll find medication is not available. And later onwards, they'll be given prescriptions to buy the medicine in NEMA-accredited pharmacies. But still, the medicine would not be available there, but be available in private-owned drugstores. Have you ever wondered why? Not only that, but even our very own government officials travel out of the country to get treated. Why don't they use the same NEMA scheme that they introduced for us to use? Not only that, why do they also run fundraisers for some of our very own citizens to get treated out of the country? Why can't they use the same NEMA scheme that they introduced for us? To show that I'm a debater who speaks from within and not from without, here's a piece of evidence showing two different individuals.
Point of interjection.
Point of interjection denied. You are not allowed to interject the speaker when they are quoting a piece of evidence.
To show that I'm a debater who speaks from within and not from without, here's a piece of evidence showing two different individuals who are being fundraised for to be treated out of the country. Not only that, there's also a piece of evidence showing that there has been a lack of medicine in clinics and expired medicine being available. May the good Samaritan please do as wise. Allow me to move on to my second point, which states weak transparency and accountability system. With
Point of
reference to
interjection
SDG number 16.
allowed.
Let me get it straight here. It seems the speaker is currently missing the motion and the point she's trying to stretch. NEMA is a government accredited institution. Another point is people in our country are leaving to South Africa for treatment. Understand the motion. That is why I want to create a special health tax to fund our governments and run clinics in our country so that no one has to travel out of the country and develop Zambia for the long future.
Point of defense.
Point of defense allowed.
Affiliates of this session, it seems that the proposing delegation do not know what they are talking about. My current speaker here talked about NEMA because we pay tax for NEMA, meaning that then the tax that we already pay, why can't that be used? Where is that going? Because as she stated, she quoted evidence that she took to the judges where we were given expired medicines. But then if we have expired medicines in Zambia, then where does our tax go? Please clarify your point.
Point of defense.
Point of defense allowed.
Members of the House, we have seen that NEMA has been doing its job already. The thing is, we do not have a special tax. Other countries have made this mandatory, but we have it too. But why aren't people cooperating? It's not the government's fault. It's that the people cannot work.
Point of defense.
Point of defense denied. May the current speaker continue speaking.
Thank you, team, for coming through. Allow me to move on to my second point, which states weak transparency and accountability systems. The effectiveness of any tax depends on a transparent financial management, which Zambia still struggles with. With reference to SDG number 16, the government talks of Vision 2030, and we're now in 2025. How sure is the government that within 5 years, they're going to manage to develop our country, especially in the health sector, without fixing the weak accountability systems and corruption? To show them a debater who speaks from within and not from without, here's a piece of evidence showing the Financial Intelligence Center, FIC, report showed persistent cases of mismanagement and weak oversight in public institutions, including the health sector. May the Good Samaritan please do as wise. Allow me to move on to my third point, which states lack of guaranteed allocation. There is no legal assurance that revenue from a special health tax will be directed exclusively to clinics and hospitals. It can easily be absorbed into the general treasury and used for other priorities. Members of this House, we've already seen that the government has a lot of projects that have been left in the middle because of lack of enough funds. Not only that, we also have the NEMA. The NEMA has been here for a while now, but we can't see exactly where all the funds are being diverted to. Instead of the funds being used in the health sectors, 30 seconds to sum up, please.
30 seconds allowed.
Instead of the money being used in the health institutions, the money is being used somewhere else. To show that I'm a debater who speaks from within and not from without, here's a piece of evidence showing the Auditor General's report in 2022. Several ministries have failed to channel earmarked funds to their intended purposes. May the Good Samaritan please do as wise. With those few but convincing points, I simply rest my case.
Thank you so much, Madam Speaker. I will now call upon the third speaker from the proposing side to continue this wonderful debate.
Mahatma Gandhi once said, "Some people were born speechless, while others were born to achieve greatness in speech. But I come as a philosopher to speak the truth for the goodness of mankind." Members of the auditorium, I do come before as the third-born speaker, agreeing to the motion that states as quoted, creating a special health tax will benefit funding to government-run clinics and hospitals in Zambia. The first speaker has already elaborated on the benefits of the sin tax. But out of the one we already have, you might have recalled NEMA, the National Health Insurance Management Authority. Yes, members of the auditorium, this is tax. In fact, interestingly, one article by...
Point of order denied.
One
You are
article-
not allowed to interrupt the speaker or interject the speaker in the first 1 minute.
Interestingly, one article by ZigOps has already elaborated about this very NEMA. In fact, it has already described it as a healthcare system which allows a more sufficient and affordable supply of healthcare to both employees and their employers. In fact, in line with this, it mentions that this is mandatory for each and every Zambian citizen to acquire access to this NEMA service. In line with this, we see this is mentioned from the National Health Insurance Act number 2 of 2018. And one article by SmartLink ERP has already talked about the NEMA calculation system, which is one which only deducts a 1% from one's monthly earnings. Not their salary or income or their wage, so to speak, but their earnings, which means it covers every form of entrepreneurship, business profits, and others. Meaning that if one only makes 100 kwacha profit, they only put a 1 kwacha to benefit. See the point? But before my evidence can be passed on, allow me to also quote from one ministerial statement from the former Minister of Health herself, Honorable Sylvia Maseo, where she expresses delight in the work NEMA has done from its implementation in 2020. In fact, here she mentions that currently 4.6 million people in Zambia are benefiting from NEMA. But members of the House, before I get too excited, this is only 23%. Because if we use our mathematical skills as intellectuals, we'll see it is out of the 20 million we have in population in Zambia. It's not even half. Not even half of the half. Still, great benefit is seen. Why do I say so?
Point of order allowed.
Affiliates of this session, the current speaker cut the motion short, which is misleading our people. So please, stop cutting the motion short.
May the current
Point
speaker...
of defense.
Point of defense allowed.
Affiliates of this House, we are debaters. We speak from within and not from without. Where's the evidence?
Point of defense.
Point of defense allowed.
Affiliates of this session, my current speaker talks about evidence. Oh my God, give us a break. Take a breath and sit down. Here it clearly states that the motion is, this House believes that creating a special tax will benefit funding to the government-run clinics and hospitals in Zambia. End of quotation. Even our moderator stated so. So please, clarify your point.
Point of defense.
Point of defense allocated to the speaker.
When we're talking of creating a special tax, I have brought NEMA. We have this tax already. But what will make it special is if everyone can access it. I've talked about 23%. What are we talking about? It's not half. It's not even half of the half I'm talking about. Then what's the point? What is the point? But still, if I get back to my points, benefit is seen. General medicals like anti-inflammatories, antimicrobials, antimalarials, all provided. Surgical procedures have been provided. We still see chronic illnesses like HIV, diabetes. They receive their medication. Eye care is provided. And still, it goes as far as cancer treatment and prevention. In fact, as a person living with albinism...
Point of interjection allowed.
Affiliates of this session, current Speaker X talked about how NEMA has allocated eye care, but just to clarify your point, Speaker X, eye care has been removed from the NEMA standard. So please clarify your point.
Point of defense?
Point of defense allowed.
Question to you. Why do you think it's been removed? You can't pay tax.
Point of defense?
Point of defense denied. May the current speaker continue speaking.
Thank you. As I continue, I am a person living with albinism, and I am proud to say, for the past 5 years, it has been good. I have continued to receive my sunscreen lotion via NEMA for no extra cost. Then what are the opposers trying to tell me? May the Good Samaritan kindly pass the evidence to the panel of judges for further clarification. Thank you very much. As I continue, conditions continue to improve for this NEMA service to work. We need the money, we need employment, we need more people to have extra income. And you've seen that the government continues to recruit more people into the work services that they have to work in. And that is good. In fact, one article by the United Nations, 30 seconds please, mentions that
allowed.
We currently have 95.8% of Zambian people working. And this is out of the 54.44% of 18-year-olds to 65-year-olds who have the ability to work. And we see that this will advance the amount of money being pumped into the NEMA service. Allow us to rebut one point quoted by the first speaker from the opposing side. Rural areas actually do have health facilities, one of which could be the Kalao General Health Hospital in Western Province, where we can see that it has been renovated by NEMA. Members of the House, this is not CDF, this is NEMA. Or NEMA. If we can have more people pumping money into the system, then Zambia would develop. Zambia would develop, and people will stop saying, if I may have permission to use my local language, Boma Ilanganepu. Your Boma has already looked into the matter, and they have given you NEMA. We just have to cooperate.
Madam Speaker,
that is why this House believes that creating a special health tax will benefit funding the government-run clinics and hospitals in Zambia. I submit. May the Good Samaritan do as wise.
Thank you so much, Madam Speaker, for that articulation and educating us on this matter. I will now call upon the third speaker from the opposing side.
Spending, bending, pretending, never ending. Yet, clinics still need mending. But before I go any further, allow me to say that all protocol is highly observed. I stand here opposing to the motion that states, as I quote, this House believes that creating a special health tax will benefit funding to government-run clinics and hospitals in Zambia, end of quotation. Having stated the motion, let's move on to my first point, which states shifting government priorities. Government priorities can change. Funds intended on healthcare could be directed to other sectors in government, such as education, debt servicing, or even infrastructure, which means that even if we do pay that special health tax, it's not guaranteed that they'll get that money and only use it in the healthcare sector, because there is no legal or constitutional guarantee. Members of the House, here with me is evidence showing that in 2023, Zambia allocated significant emergency funds to debt, restructuring, and fuel subsidies, showing priorities can shift away from social sectors. Members of the House, as I'm sure we all know, people are speaking of Vision 2030. And in Vision 2030, we have SDG 3, which states quality health. But if funds are being taken away from the health sector and used in other areas like education, how are we going to achieve quality health by 2030? May the Good Samaritan please do as wise. Moving on to my second point, which states an equal distribution. Even if funds are available and people do pay the taxes, majority of the time, urban areas receive more support than rural areas, which isn't meant to be the case, given that tax is meant to be...
Point of interjection.
Point of interjection allowed.
Members of the colloquium, when we say special health tax, it means it's separated from these other taxes. It's funded, only directed into the health sector. Special. You have a dictionary, look into it.
Point of defense.
Point of defense allowed.
Speaker X, I know you said special health tax, but it's not guaranteed that that money is only going to be used in the healthcare sector. Because even you, giving you money, you can use it for other things that you want. So please, clarify your points.
May the current speaker continue speaking.
Affiliates of this session, rural areas usually receive less than urban areas, which isn't meant to be the case, given that tax is meant to benefit both rural and urban sectors in government. Here with me is evidence showing that in 2022, the annual health bulletin showed that urban areas received 60% of the national health budget, while rural areas, which have more people, by the way, received less than 40%. May the Good Samaritan please do as wise. Moving on to my third point, which states poor revenue collecting performance. As we all know, Point of interjection.
Point of interjection allowed.
Speaker X, could you tell me how many rural areas have hospitals and clinics?
Point of defense.
Point of defense allowed.
Affiliates of this session, Speaker X is talking about. It seems the proposing delegation does not understand and their interjection is so flabbergasting. So, what my current speaker is trying to say is that urban areas have more support than rural areas. So please, before you interject, a delicate speaker like her, please clarify your point.
Point of defense.
Point of defense denied. May the current speaker continue speaking.
ZRA already struggles to meet tax collection targets. Therefore, adding a new tax doesn't guarantee that the collection target will be met or that to be collected effectively. As we all know, in 2021, ZRA fell short of projected non-mining tax revenue of about 9% according to Ministry of Health data. Moreover, people already pay multiple taxes, some of which include NIMA and personal levy. As we all know, personal levy is meant to improve sectors around us. And members of the House, if you check around, personally, I feel like things are getting worse than better because we keep on paying tax and money is used for things that some of us can't even see. Moving on to my fourth point, which states bureaucratic bottlenecks. Funds often take months to be dispersed, leading to delayed improvements at hospitals. Members of the House, as we all know, when money is taken to the government, it's not there and then when it's invested into those areas. Matter of fact, it goes through different procedures. Some of them may be corrupt, some of them may be legal, but the point is they take time. 30 seconds to sum up.
30 seconds allowed.
They take time. Therefore, it's not guaranteed that when we pay the money there and then to be allocated to the healthcare sector, and it will not undergo corrupt deeds in government. May the Good Samaritan please do as wise. With these few points, I rest my case.
Thank you so much, Madam Speaker, for those quotations and evidence-based information. I will now call upon the summarizer from the proposing side to give us the rebuttals.
Originating from a land of work and joy, I stand here to bring intellectual clarity to every Zambian mind. For blindness is not the absence of vision, but the failure to see, members of the House. Riding on protocol already observed, allow me as a summarizer to put a firm concrete on the arguments that have been presented by the proposing side. The syntax, fairness and responsibility. Our first speaker powerfully introduced the idea of syntax, a levy on alcohol, tobacco, and sweetened or energy drinks. This is not a punishment, but a solution. Members of the House, studies show that 18% of Zambians abuse alcohol, 15% use tobacco, and a lot of youths are abusing these sweetened beverages, leading to obesity and other trends that are harming our country. Members of the House, let's speak about obesity among the youths. I can see that I'm halfway there. Members of the House, to show that I'm a speaker speaking from within and not from without, these are statistics showing how many Zambians are abusing tobacco and how many deaths are taking place. What is the economic cost on smoking and tobacco use in Zambia each year? More than $1 billion. $1 billion. Imagine. Members of the House, let us look at it like this. A small portion that is funded towards the people that spend on harming their health can go towards saving others. If you can afford to harm your liver, then you can afford to save someone else's. Our country lives on the motto, which is one Zambia, one nation, not one bottle, one problem. Members of the House, food for thought. Our second speaker emphasized sustainability. Zambia's health sector has long relied on foreign aid. Generous, yes, but unpredictable. We cannot build a stable health system on temporary support. A special health tax, I repeat, special health tax. Policies can be made, policies will be voted on, they will become law. Who's going to take it? Zambia is a country that has strong laws, members of the House. I can see it there. Take charge. We want Zambians to take charge of Zambian health, members of the House. We want our country to have independency, consistency, and dignity to our health sectors. Members of the House, let us take lessons from other countries. Countries like Botswana, South Africa, Kenya, and Rwanda. Rwanda, members of the House, have successfully introduced targeted health levies, which now fund hospitals, HIV treatment, and public health education. We too can learn from them and invest in ourselves instead of waiting for handouts. Members of the House, 61 years is no joke. We can't be pleading on our knees for other countries' help when we have the ability to save ourselves. 61 years of pleading. That's not a joke, members of the House. My other speaker strengthened the idea of NEMA. NEMA, healthcare and staffing. Honorable members of this colloquium, we also discussed NEMA, a noble initiative that still faces a lot of challenges, members of the House. Allow me to speak from a personal experience. I'm a person with myopia, photophobia. I've been waiting 4 solid months to get my spectacles. They are still in processing, members of the House. Still in processing. But I won't blame NEMA. I'll blame the underfunding, the understaffing. Members of the House, if something as small as a pair of spectacles takes that long, imagine dialysis, cancer treatment, HIV treatment, surgeries, and many more. Members of the House. Members of the House, food for thought. Imagine if all these things that are harming our health in our country were redirected into a sin tax and NEMA. Okay, let's look at it like this. How many people pay for NEMA in our country? Mostly, it's the civil servants and small percentage of the elderly. Imagine if every Zambian was paying. Good health would be in our country. Our country would be developed by now, members of the House. Because, 30 seconds to wind up.
30 seconds allowed.
To show that I'm a speaker who speaks from within and not from without, these are statistics from NEMA, statistics of people abusing drugs in our country. May the Good Samaritan take these pamphlets of evidence to the judges. What we are fighting for is national pride and unity, members of the House. This motion is about ensuring that every Zambian, regardless of age, the ability of education, regardless able, disabled, has quality health care. Members of the House, this fund is not a punishment, but a promise that our government-run hospitals will have medicine, equipment, and staff. So let us choose to better the healthcare of our country. Because one Zambia, one nation is our motto, not one bottle, one problem. I rest my case.
Thank you so much, Mr. Speaker, for that brief but detailed summary. I will now call upon the next summarizer to come forth and give us the rebuttals.
Special tax, no facts. Let's look at the facts before we react. But before I go in further, let me state that upward score is highly observed. Back to my main motion, which states, as I quote, this House believes that creating a special health tax will benefit funding to government-run clinics and hospitals in Zambia, end of quotation. Affiliates of this session, as a summarizer, it is my duty to summarize, analyze, otherwise you not understand. So sit back, relax, and enjoy the show even as I run you through my points. But before I go in further, allow me to rebuttal what the proposers had talked about. Earlier on, I had heard their summarizer talk about sweetened beverages and how if we remove that, we're going to save lives. But affiliates of this session, here with me, I have evidence that clearly shows how smuggled trucks had alcohol in them, and then they had lost about revenue loss of 4.9 million revenue loss. May the Good Samaritan please do as well. Affiliates of this session, heading on to my first point, which states, as I quote, shifting government priorities, end of quotation. Government priorities can change. Funds intended for healthcare could be redirected to areas like debt servicing and infrastructure regeneration. Example given, in 2023, Zambia allocated significant emergency funds to debt restructuring and fuel subsidies, showing how priorities can shift away from the social sectors. Heading on to my second point, which states, as I quote, unequal distribution, end of quotation, which refers to SDG number 10. Even if funds are available, urban hospitals often get more support than rural clinics. The Ministry of Health's annual health bulletin in 2022 reported that urban areas receive about 60% of the national budget, while rural areas receive less than 40%. Affiliates of this session, the proposing delegation might bring out a fact to state that urban areas have more population than rural areas, but what we have to keep in mind is that the level of disease is always going to be the same. Heading on to my third point, which states, as I quote, poor revenue collection performance, end of quotation. Affiliates of this session, the Zambia Revenue Authority, also known as ZRA, already struggles to meet tax collection targets. Adding new tax doesn't guarantee enough money will actually be collected. Example given, in 2023, ZRA fell short of projected non-mining tax revenue by about 9% according to the Ministry of Finance data. May the Good Samaritan please do as well for further adjudication. affiliates of this session, so even if the tax is created on paper, weak collection means that health facilities might not receive the expected funds. Heading on to my fourth point, which states they're called bureaucratic bottlenecks, end of quotation. Funds often take months to be distributed, leading to delayed improvements at hospitals and clinics. Proposals may promise faster distribution, but without major administrative reform, the same delays will persist regardless of new taxes. With me here, I have evidence that clearly states that the country has lost about 2.7 billion available medicines and medicine supplies to the agency, but medicine equipment is still available. If they have given us money to fund these things, where do we take the money? Yet we still pay tax for NIMA, as my second speaker emphasized. May the Good Samaritan please do as well. Heading on to my fifth point, which states, as I quote, existing inefficiencies remain, end of quotation. If internal inefficiencies aren't addressed, additional funding won't solve anything. Example given, the World Health Organization, also known as WHO, in 2021 report on Zambia noted that 30% of the health expenditure is wasted due to inefficiency and poor resource management. May the Good Samaritan please do as well for further adjudication. Affiliates of this session, heading on to my last point, which states, as I quote, weak monitoring at facility levels, end of quotation. Even if money reaches districts, monitoring at clinic level is weak, leading to poor tracking of how funds are used. Transparency International Zambia, also known as TIZ, in 2022 reported that many rural health posts do not keep proper expenditure records, making accountability very, very difficult. So even if the special health tax increases the national budget, it won't guarantee better funding on ground. The idea of special health tax sounds noble, but nobility without accountability is futility. As ZRA reminds us,
My tax, your tax, our destiny.
and if our destiny in healthcare will remain one of our major struggles, it won't progress. So with those few accountable, transparent, and administrative points, I rest my case.
Thank you so much, Madam Speaker, for ending this debate in style. What a brilliant battle of the brains it has been. But stay tuned as the judges tally the results. Who do you think has won?
Healthcare is a fundamental right for every citizen. In Zambia, the health sector is being strengthened thanks to the strategic use of tax revenues. Taxes collected from individuals and businesses are vital in funding healthcare services. These funds are used to build hospitals, purchase medical equipment, and ensure the availability of essential medicines, providing quality healthcare for all. Thanks to the ZRA's efforts, new hospitals and health centers are being constructed across Zambia. These new facilities bring quality healthcare closer to communities, ensuring that more people can receive the treatment they need. Tax revenues also ensure that hospitals are equipped with modern medical equipment. From diagnostic machines to surgical tools, these resources are essential for providing comprehensive care. A portion of the tax funds is dedicated to training and paying our hard-working healthcare professionals. Investing in their education and skills means better healthcare for patients. By supporting healthcare through tax revenues, we are building a healthier Zambia. Zambia Revenue Authority. Your tax, my tax, our destiny.
Welcome. The moment we've all been waiting for. The judges have made their decisions. The results are in. Nawoya Secondary School. Has scored a total of 892. Mukabambo II has scored a total of 892. total of 939, which means Mukamambo II has qualified to the next round. See you next week for another debate.